everyone, I am Maria Andrea Di Somoria, a first-year nursing student from Our Lady of Fatima University. So for today's video, I will be doing a third demonstration for the assessment of the peripheral vascular. So the first thing you want to do is to identify the client or the patient. So to do that, I will be interviewing the patient. So we need to first identify the client or the patient in order to ensure that the client's identity will match with the correct treatment or to ensure that the client will receive the service treatment intended for them. So, good afternoon, ma'am. I am Maria Andrea Somaria. I will be your student nurse for today. Can you kindly confirm your name and your birthday?
Yes. I'm Manita De Los Santos.
Birthday po.
My birthday is July 14, 1944.
And how old are you, ma'am?
I'm 78 years old.
So, Ma'am Juanita, I am here to perform an assessment on your peripheral vascular. So, Ma'am, we do this assessment to ensure that everything is normal in your peripheral vascular.
Yes.
So, if I have noticed any abnormalities, I will surely note them in order to for further evaluations and observation, and also to prevent any further complications. So also remember that if there are any curtains, doors in the room, we have to close them in order to provide a privacy for the patient. So before I proceed to the actual procedure, I have some questions lamang po. So, have you ever noticed any color, temperature, or texture changes in your skin?
No.
Do you experience pain in your legs?
No.
Do you have any leg veins that are rope-like and bulging or contorted?
Yes.
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 This po.
Ano? Varicose.
Do you have any swelling in your legs?
No.
Have you ever had any heart or blood vessel surgeries or treatments?
No.
Do you have a family history of diabetes, coronary heart disease, hypertension?
No.
So, ma'am, do you smoke cigarettes po ba?
No.
Do you exercise regularly?
Yes.
Do leg ulcers or varicose veins affect how you feel about yourself?
No.
And do you wear support hose to treat varicose veins?
Yes. No. No.
So, after that, we can now finally proceed to the actual procedure. But before that, I will be performing a proper hand hygiene by applying alcohol in my hands. So now we can now proceed to the first part of the assessment, which is I will be inspecting the arms and the arms of the client. So first, I will be inspecting the arm size and the venous pattern, and also to look for edema, if there are any signs of edema, and to note the color, the size, if it's equal bilaterally. Next is I will be inspecting for the skin coloration of the client's arms. So, as I observed, I have noticed that the skin color of the client is matched with her skin tone. So, it is equal in color bilaterally. Okay. Next is I will be inspecting the fingertips for clubbing. If the fingertips is, if there is enlargement of fingertips. So I have noticed that it is no enlargement. Okay. Next is I will be palpating the arms, the hands of the fingers of the client using my dorsal fingers to note the temperature. To note the temperature. So it is warm bilaterally. That's good. Next is I will be doing I will be assessing the capillary refill time. So I will be applying a pressure of the nail bed of the client and then release it. Then calculate the time it takes for the finger to return its color. So the nail bed or the color of the finger of the client gets back to normal. It is less than 2 seconds. So that's normal. Next is I will be palpating the radial, ulnar, and brachial pulses of the client to note the quality and the strength of the pulses. First is the radial. Okay, next is the ulnar. Next is the ulnar. So I am using my pads of my fingers, specifically my index and my middle finger. Next is the brachial. So I have noticed that the strength of the pulses of the radial, ulnar, brachial of the client is all equal bilaterally. Next is I will be palpating the epilotocrial lymph nodes. It is located behind the elbows. So, see. So it is not usually palpable, but that's okay and it's normal. Next is I will be performing the Allen test. This is to evaluate the potency of radial and ulnar arteries. So also to observe the palm color, if the pink coloration of the palm will return quickly. So we're asking you to clench, twist repeatedly, maraming beses, and then close gently. First, I will be releasing the radial. Release. Okay. Next, again, clench repeatedly, then close tightly. Then I will be releasing the ulnar. Release. Okay. So I've noticed the pink coloration return quickly. Next is I will be inspecting the legs of the client bilaterally to note the skin color of the legs. So I have noticed that the color of the legs of the client is bilaterally equal and it is same as the skin tone of the patient. Next, I will be also looking for the skin distribution in the legs of the client. And also, I'll be looking for any signs of edema if there are edema on the legs of the client. So can you please? So if the calves of the client is unequal bilaterally, we have to measure them in using the measuring tape. So as I have observed that the calves of the client is equal bilaterally, but I will be measuring it for you to see how to measure the calves of the client in centimeter. Mm, okay, it is 34 centimeter. The other one
Okay lang nakatulog ako.
it is also 34 centimeter. Also, if the client has edema or you notice signs of edema of the client's leg, so you have to test if that edema is non-pitting or pitting. So to do that, you have to apply a pressure to the edematous area. So you apply pressure and then release it. So after you release it, if the edematous area is remain indented, it indicates that there is present of pitting edema. Next is I will be palpating the skin of the client to note the temperature. So I will be using my dorsal surface of my palms to be palpating it. So as I palpate the client's skin, it is normally warm and temperature. Next is I will be palpating the superficial inguinal lymph nodes of the client. This is to note the size, the mobility, and the tenderness of the lymph. Next is I will be palpating and auscultating the femoral pulses of the legs of the client. Over to the side. So, this here. So I am assessing the amplitude or the strength of the pulses here in the femora. Next to the other side. And bend the knee. And then to the side. Here. I've noticed that the pulses or the strength of the pulses are equal bilaterally. is I will be auscultating the femoral pulses using the bell of my stethoscope.
Yeah.
So I am listening for any movements. Next,
Yeah.
one. So I have noticed that there is no any movements. Next is I will be palpating the popliteal pulse of the client. It is located here. So I will be assessing the amplitude or the strength and the weight of the pulse. Okay. So I am using my finger pads, my index and my middle finger pads. You can also ask the client to in a prone position. So you can also auscultate there by raising or flexing the knee of the client and then start to palpate the popliteal area. Next is the dorsalis gladys pulse. So it is located here. Using my two finger pads, just apply light pressure. Other side. Mm. So I've noticed that the pulse is in equal strength bilaterally. Okay. Next is for the posterior tibial pulses. It is located below the medial malleolus. So it's located here. So I've also noticed that the strength of the pulses is equal bilateral. One pulse. Next, we will be checking or inspecting the varicosities and thrombophlebitis of the client. So I will be asking the client to stand. Stand. Face the so here. I have noticed a varicose vein here. So the client has varicose vein and the right side. So next, I will be checking for the human signs. So to perform this, I will be asking the client in the supine position. She will report any pain or discomfort during the test or procedure. This, pinch, this. Do you feel any pain? Sakit mo ba?
No.
How about the other side?
No.
Hit, pinch, pinch, pinch. Do you feel any pain?
No.
So also, if varicose veins are present, we will perform the manual compression. It is to assess the competence of the veins. So I will be asking the client um, to stand. So that's the end of the assessment of the peripheral vascular. So if I have noticed any abnormalities, so I have noticed that the client have varicose veins, but it is just the varicose is not in pain. It is no pulsations, so it is competent. So I will be referring her to the other professional healthcare provider for further evaluation and observation. So thank you, ma'am, for cooperating.
Thank
Yes.
you.
Next and lastly, I will be performing the Trendelenburg test. So this is to assess the competence of the saphenous vein valves. So the client is in supine position. So I will be flexing the legs for 90 degrees for 15 seconds. Okay. Then I will be putting the tourniquet here. Then ask the client to stand again. Stand. Stand, tayo po.
Kayo?
Oo.
Paano tatayo nakatali?
Hindi. Tayo po. Tayo. So, 30 seconds. So, after 30 seconds, we'll be removing the tourniquet. So, as I observed that the it is quickly refilling the color. And just repeat to the other side.